So if you have headaches, you're gonna need some visual changes on one side in your eye, or you have even some sinus pressure that's happening, then this is gonna be the video for you. We're gonna go through some kind of our evaluation and what we find to help you help those types of conditions. So when we look at the neck moves very differently. So when we get like rotation of the head, you can get it down low and then you also get it up high. So how usually when we have visual changes, headaches, even like a little bit of nasal congestion, it happens because we have some stuff that's happening up high in the neck and it will wrap through here. So we've had people that are like, oh, my vision's much better. I've been going to the eye doctor and no one can figure it out. And it was actually coming from our neck. Or even just like sinus congestion, it like just completely clears the sinuses because it's all in this direction and through here. So when we look at upper cervical, we want to see how it moves, and how we can do that is if we take the head into flexion, we're taking the rotation out lower. And what we're going to do is we can rotate the head one way, and then we can rotate the head the other way. So like even on her, she's a little bit limited this direction compared to this direction. So we know that there's something typically going on one side. Now, where do you feel that? Do you feel that on this side or do you feel that on that side when we go this direction? On this side, yeah. So for me, then there could be an issue going on over here. There might be an issue going on over here, but we already know that there's some tightness in the upper cervical that needs to be addressed. And so that's one thing that we look at. We also look at the vertebrae down below, like we want to look at our side bending to see kind of how the vertebrae in the middle, kind of C3, C4, C5, how they kind of move a little bit. And so we find that there's a little bit of tightness in through here too. So we want to get everything moving, because if things aren't moving, then what happens is the muscles will tense up and protect, and they'll protect up high and through here. If everything is moving and we don't find any issues whatsoever and they're getting some sinus pressure, some headaches, you can just have tightness in the suboccipital muscles up and through here. And so we can work on just releasing some of the tightness up through here. There's things that you can get called suboccipital pads that you can lie on that have little like fingers, and that you can kind of hold, and they can just put pressure through here to kind of release some of that tightness. But if you're not moving, we've got to address the movement piece first. So that's the first piece as well. Now, with other headaches and things, you also can have stuff in the upper ribs. So when you go up through here, you can find that there could be some tightness. This is like the first rib, and we just want to see how it moves. Just like on the other side, we'll see how it moves. Now, when we think of like how the first rib moves, it moves up and down. So if we are breathing with our shoulders, that can be a problem. If we are always elevating one side as we're doing stuff, or we're kind of stressed, that's going to pop up that first rib. The muscles attached down through here also attach up in here, can also give you headaches. Now, typically sinus and visual changes will only happen up high. So how do we fix anything that's up high through here? If it's on one side and one side's not moving very well, then we'll take them to side bend. This is going to stretch the joint, side bend away from the tightness, and then kind of rotating all the way down. Can you feel that stretch through there? Yeah. And so that's going to stretch the one side. So this is one way that we can do it. We also can take it, if we want to go a little bit farther, we can take them into extension. So scoot back towards me until your head's off the edge. Keep on coming. Yep, perfect. So sometimes you can, and we show these exercises that patients can do to really stretch the upper joint, and you'll rotate here and then you'll just kind of drop it. Can you feel that stretch a little bit more? Yeah. And so you can get off the edge of a bed and do the same thing. So you're really moving away from the tightness that we found. So we flexed her and rotated her to the right, and that was tight. So I'm going to side bend away and rotate towards, side bend to the left, rotate towards the right, and then we kind of extend her off the table. And this is just how we can kind of stretch that joint to really kind of open it up. And so that's one direction that we do. And then go ahead and scoot back on the table. And then you just kind of can release some of the tightness. You'll find stuff that's up high into Oh, there we go. There's a spot right in through there. This is just suboccipital area that's a little bit tight. So once we kind of get everything moving, we will also release a lot of the tightness, and that's going to release a lot of the sinus pressure that you have. It can release any kind of visual changes that you have, and it also can well, help with your headaches as well. So when we come up and we rotate, even by just doing that, you can see how much more, can you feel the difference there? It's opened up that space. And if you can open up the joint, then you will be able to help with that muscle tightness will go away, because if the joint's not moving, the tightness is there to protect. So you can release all the tightness that you want, but you've got to open up that joint first. So again, if you're tight on this one side, so let's say that you're tight on the right side, you're going to side bend, and you can just take your head to the side, and then you can rotate it, and you can add a little pressure on your chin to open up that joint. And that's going to help like get that mobility back. And then you can also do the same thing with your head slightly off the edge of the table. Scoot back towards me, just relax through there. So and then you can do the same thing, side bend, rotation, and then the edge of the table, you're gonna get some extension through there to really open up that joint. Now you're gonna do it like you're stretching a muscle. You're gonna hang out there for a good 30 seconds to a minute. I would say doing this 2 to 3 times a day to really kind of open it up. The big thing that we always look at from a posture perspective of what you do throughout the day, if you're tight here and you're just always rotated one direction or rotated the other direction, you're gonna notice that things are gonna tighten up. So making sure if you're in the computer, you're actually looking straight ahead while you're doing it, that you're not always looking off to one side. That's what causes a lot of this upper cervical issues that can give you those headaches and those kind of things. So those are things that you can look at. Now, go ahead and sit up. If you have a first rib issue and we need to work on getting that, go ahead and face that direction. This is when we use this. You've seen this before. And we're going to take it on that top rib up through here, and we're going to just kind of pull it down. So she'll take it, grab there, and you're going to hold this hand. Yep. And then you're just going to push down. Can you feel that through there? Yep. And so that's going to help mobilize that first rib to get that moving. So if we notice that the headaches are coming from more of that first rib, then we can mobilize it using the Theracane to open that up. So those are all the tips on how to really help people that have like sinus issues, that help people that are having visual changes and headaches. A lot of times they go hand in hand. This is how you can solve that. And make sure you subscribe to our channel. If you like what we have to do, make sure you hit the like button. If you have any comments, comment below any things that you're having, and we can kind of help you manage through some of your issues that you're having with headaches, sinus, or visual changes. And we'll see you next time.